Previously in CLL, prior to the advent of small molecule inhibitors, we used different prognostic tools to help us determine how well they would respond to chemotherapy, such as deletion 13q, deletion 11q, deletion 17p, along with IGHV mutational status, CD38, ZAP70, etc. And since the advent of small molecule inhibitors, we have seen that the prognostic value of some of our previous biomarkers has actually diminished, meaning that many of our small molecule inhibitors work much better in some of the bad prognostic scenarios that occur in CLL. So in this review article, we looked at the phase 3 data across the board, and we determined that many of the prior biomarkers that we used to determine prognostics are probably not as relevant as they were previously. Deletion 17p and TP53 mutation are still prognostic in small molecule inhibitors, it seems, and complex karyotype 2 is one of the newer prognostic markers that we should be paying attention to in the future with further use of small molecule inhibitors.